Good morning. Welcome to Dementia Q&A. I'm Dr. Marc, internist and geriatrician. This week's question: how do I talk about dementia with a loved one after we've made a new diagnosis? It's a very good question. If you are struggling with how to start these conversations with your loved one, you are not alone. These are really tough conversations. What I want to do today is talk about 3 aspects of these conversations that might be helpful as you gear up to get started. First, we'll talk about fear. Second, we'll talk about whether this is really a surprise diagnosis or not. And third, are there any consequences of the conversation itself that I need to be worried about? All older adults today are concerned about memory. They think about it, it's joked about a little bit, it's on TV everywhere. But in my experience, older adults are less fearful about the actual symptoms or nuts and bolts of the disease itself in their daily lives, and they are much more concerned about how they are viewed and how they are treated by society, by family, by people in general, once they become someone who has dementia. Obviously, millions of people have had fantastic, compassionate care from their loved ones over many decades. But the people we're talking to, who are generally older than us, can look back across their lives and they see examples of things that didn't turn out so well. Often, there were family members or loved ones who were kept at home, hidden from view, isolated, alone, often ignored, perhaps forgotten, and many people obviously end up in institutions. That's what older adults are more worried about than just the diagnosis itself. And you can do a lot in those conversations to reassure them that that's not how you're going to treat them. You can reassure them what you will do, what family and friends will do or not do to alleviate some of that fear. I would focus a little bit more on that than I would about the cognitive tests or medications or advanced care planning right up front. Focus on reassurance. When I think of what I call surprise diagnoses, I think of friends who have gone to the emergency room for an injury, had a CAT scan of some kind, and ended up finding out that day that they had cancer. That's a massive surprise, a total shock to the system, and it's awful. Often in dementia, the diagnosis is not quite that level of surprise. The person we're talking to may know that their thinking has not been 100%. They might be keeping lists to keep track of things. They might even have adjusted some of their routines to deal with memory loss. They may or may not remember going with you to the doctors for cognitive testing. They might have resisted going for a while and then eventually acquiesced. In general, in most cases, this is not really a new, first time out of the gate surprise for them or for you. If you think that you're the first person to ever think of it and the first person to ever have a conversation about it with them, it's often not the case. So in that sense, be reassured that they may have some awareness of the dementia already. Lastly, people are often worried that the conversation itself will do 2 things. 1, it'll make the dementia worse, which it won't. And second, that it might set off depression or even suicidal thinking. There's really no evidence that having a first-time conversation about memory loss with somebody itself can trigger depression or suicidal thinking. We're always on the lookout for the mingling of depression and dementia. We know sometimes they go together and can affect each other, but the actual conversation itself being the cause of depression, there's really no evidence for that, and you shouldn't be overly worried that that's going to happen. One last word about language. For many families, using words like dementia or Alzheimer's, it's just too difficult right up front. People often will talk about the memory loss for many years before they sprinkle in words like dementia or Alzheimer's. Don't feel bad if you're not able to use those words right out of the gate. a lot of people struggle with that too. I hope that thinking about these issues around how to talk about dementia with your loved one is helpful as you think about a conversation that you might have to have in the not too distant future. If you've liked or shared or subscribed to the page, it's greatly appreciated. I do thank you for watching today, and I look forward to seeing you all next week.